So the Cornwall and Isles of Scilly Health and Care System is a unique opportunity for the whole health and social care partners, staff and colleagues to come together to transform the way in which we go about delivering health and care to our citizens. But we need to make sure that we deal with the health inequalities across our county, and also to make sure that we actually do things at place and community level. There's no better place than doing things at community and at home level, and we need to actually transform the way in which we actually do things from a patient perspective, and that's a really exciting opportunity for us to think about doing things new and differently.
Our aim as an integrated care board and a system is to make sure that Cornwall is the best place to be born, the best place to live and the best place to grow old. This is about making sure that everybody in Cornwall and the Isles of Scilly is looked after as near to home as possible, and by people who know and are able to say what it is that we individually want and need.
We've probably got three main challenges right now. Firstly, in Royal Cornwall hospitals we've got more than 100 of our hospital beds occupied by patients who've finished the treatment, who are waiting to go home with care or into a nursing home. That translates into a second challenge, which is long waiting times in emergency departments and the ambulance services because of those beds. And the third aspect is both of those things translate into longer waiting times for cancer services and for planned surgery. The integrated care system provides a real opportunity for the whole system to work together to address all three, and that's a fantastic opportunity to improve the outcome and experience for patients and for staff.
And the pandemic has told us that actually good health isn't just about good health services. It's fundamentally shaped by the way in which that we lead our lives, how we look after our own health and that of our neighbours and our communities. And that's why I'm really passionate about the integrated care system, about how health services can work together across with housing, education, social care services, our wider park services, leisure services, to create the conditions that everyone can start well, live well and age well.
This is an absolute game changer. It's going to be one budget and we're going to be able to provide a really good route to good health. I can understand how residents get frustrated in knowing who they need to speak to. There should be one voice hearing exactly what's happening in your life as an individual.
As a GP, I see patients who have to travel between multiple different geographical locations and multiple different providers. The integrated care system is here for us to all work together. We're building on some of the work that's come from previously and really working together, particularly with the voluntary and third sectors, with the local authority and local NHS partners, to work together to deliver the best kind of outcome for the people that we live and work with.
The role of the voluntary sector in the new integrated care system will be helping people who need it most at a time when they need it most, who often don't have friends and family to support them, helping them become well, stay well and live well, and also address those issues that they face, such as unemployment or housing or food insecurity, so that there's less health inequality for that person and their family.
So it's crucially important to have good emotional and mental health and well-being, as well as physical health, and our services in the integrated care system are here to support you wherever you need it.